Today we're talking all about microdiscectomies. Welcome back to another episode of Twins Talk Therapy. I'm Adam.
And I'm Aaron.
And we are identical twin brothers with over 30 years of experience in massage therapy, physical therapy, and athletic training. And we use our expertise to discuss things for you.
All right, and in this video we're talking about microdiscectomies. So what is a microdiscectomy? This is a surgical procedure. It leaves a 1.5 inch scar on the back in the area of the disc that is injured. And so this is a disc injury. So the little structure that's in between each one of our vertebrae that helps absorb shock through our spine, helps absorb force. These discs can become injured, and they're made up of two parts. The ring on the outside of the disc is called the annulus fibrosus, which is a dense cartilaginous tissue, very fibrous, and that's how it gets the name annulus fibrosus. The inside of that is softer, and it's called the nucleus pulposus. An analogy that is used a lot of times is a jelly donut, and with a disc herniation, this is when the nucleus pulposus presses through the annulus fibrosus and into the spinal cord. And so it's like the jelly of the jelly donut getting pushed out of the donut into the spinal cord space. This compression on the spinal cord pushes on nerves, and this causes that sciatic pain that can get very, very bad in people. Burning pain down into the butt and down the back of the leg. You can get tingling, numbness, burning on the outside of the lateral head of the calf or the outside of the lower leg, and it can go even into the foot, also causing numbness and tingling. A lot of times numbness in the foot and toes, where people just have a hard time feeling their foot in this injury. So you want to talk about the surgical procedure and what it's correcting?
So we just talked about a disc herniation, and in this video we said it was about microdiscectomies. Well, a microdiscectomy is the procedure used to fix a disc herniation, and that is usually when the disc herniation is severe enough that it's put in enough pressure on the spinal nerve that the person is pretty miserable. And it's a nice procedure. As much as we discourage surgery with our professions, we like to see therapy, massage done in place of surgery before. We like to be conservative. But in this instance, a microdiscectomy is minimally invasive. The recovery is fairly easy. It's about 6 weeks of weight restrictions, and the symptoms are typically gone when the patient wakes up from surgery. So they take that herniation, they trim it off that's pushing into the nerve. So without that nucleus pulposus pressing on the nerve, the symptoms are pretty much alleviated right away. They'll usually wake up from surgery and they don't have the numbness and tingling. And we know someone that has had one recently, so they were experiencing twitching and spasming in the glutes, burning down the leg and the lateral head of the calf muscle, and numbness and tingling all the way into the feet and toes. And they are going to get the microdiscectomy, and they were told in their consultation that they'll feel really good right away. And in that case, we don't discourage surgery. That's usually the best option in certain circumstances. So if any of you are suffering from pain, sciatica, going down the leg, if it came on pretty sudden and severe, you might want to go to your doctor and get an MRI, have it checked out to see if there is a significant herniation. And in that case, a microdiscectomy may be the best course of action. But again, this is not meant to be used in place of medical advice. Obviously, check with your primary care physician before making any decisions like this, and they'll obviously guide you in the right direction as far as MRI and seeing what's actually going on with you. So
yeah, and it's good you mentioned the imaging. Obviously, imaging studies have to be used in order to confirm a diagnosis. Even the physicians themselves, they can evaluate you, and they can, based off the tests, assume what is going on, but they're always going to get imaging to confirm and then move from there from what the imaging study shows. So that's pretty much it. Do we want to go into some stretches that you can use if the disc hasn't herniated too bad? We discussed these in a previous video, but maybe you want to demonstrate some exercises?
Sure.
All right. All right, guys, Adam's getting into position to show some exercises that you can do. And this would be stuff to do if you haven't reached the point of needing surgery, that disc hasn't herniated quite as bad as it needs to be qualified for this microdiscectomy procedure. So, Adam, take it away. All right, so the first exercise we're going to do is cat-cow, cat-camel, depending on who you ask. So the cat motion would be when you arch your back up and the thoracic spine is flexing, putting some flexibility and some range of motion in there. Then when you come out of that, you let your stomach come down and sag down, and you're putting the arch in your low back. That's the camel or the cow. And you're just going to do that back and forth. That's going to work some range of motion and some flexibility into your spine. After that, you can swing around to your back and you can do bridges. So you want to kind of tuck your tailbone under and then push your hips up off the floor. And you can do 10 to 20 of these, as much as you can tolerate, really. This is going to help build your glute muscles so that you have a stable base for your spine. And if your disc isn't herniated too much, this shouldn't hurt too badly to do, and it should help you over a few days. You should notice your back getting stronger. All right, and so last we're going to show some diaphragmatic breathing using a yoga ball. You can put your feet on the wall, but we're using the yoga ball to prop the lower legs up, and Adam's going to demonstrate how to properly breathe through the diaphragm, and this typically helps calm down nerve pain. So we're gonna go back to Adam. All right, so you want to get a yoga ball, put your legs up so your hips and knees are at 90-degree angle, and then to breathe properly with your diaphragm, you're just gonna make sure your belly comes up when you breathe in, and then you're going to tighten your tummy when you exhale. So it looks like this. And you're going to do 10 breaths at least, maybe more. You can take a break in between, do a couple sets. But when you get your belly involved with the breathing, it tends to relax the low back, and having your hips and knees bent up like that just puts less stress on your abdominals, and that'll get your low back to relax and alleviate some of that pain and let you know whether or not it's time to go see the doctor or whether you can just rehab this at home. All right, that wraps up this video on microdiscectomies that can be used in order to help alleviate sciatic nerve pain. And do you want to close out the video with our prayer requests?
Yeah, if you guys have any prayer requests, please leave them in the comment section below. We'd love to pray for anyone that needs prayer warriors out there, and we'd like for anyone else watching, if they can see someone's comments about a prayer request, that you guys can join the prayer chain as well. So if you have any other questions or comments, leave them in the comment section below. If you'd like to email us privately about a topic you'd like us to do a video on, email us at twinstalktherapy@gmail.com. And stay tuned, because we have some exciting things coming down the pipe here at Twins Talk Therapy. We're going to be having some guests joining us, I think, and
looking forward to that.
Yeah, we got some exciting stuff coming down the pipeline, and I think you all will enjoy it. So
before we go, please don't forget to like this video, click that subscribe button, it's free, and click that bell notification so you can be notified anytime we release a new video. And that wraps up this week's episode.
See you next time.